Hello, good evening, everyone, and welcome to another exciting episode of our Bella by Choice Facebook live chats. And we'll kindly request that we give us 2 minutes to sort out some of our network connections issues, and then we'll be back in that 2 minutes. Thank you. Hello, everyone. Welcome to another Facebook and YouTube live segment of our Bella by Choice. As stuck, I carry Bella by choice, not by chance. So today we will discuss a very important topic. Hello, can you hear me? Can everyone hear me? Yes. Okay. So today we will discuss a very important topic. Contraception, implant. But before we continue, we would like to say a big thank you to our partners. Those who make this work. AWDF, Global Fund for Women. WFD, Movement for Women Alliance. DKT International Nigeria. Cross River State Ministry of Health. UNFPA. Cross River State Primary Health Care Development Agency. Thank you all so much for your support and your kind. So before we continue, we'd like to introduce our partners. We'd like to introduce our speaker, the Opilius Okonobu. Welcome, sir. Doctor. Hello, doctor.
Yeah, hello, good evening.
Good evening, doctor. Nice having you here.
Same here, I'm happy to be here as well. Thank you.
Thank you so much for honoring our invitation.
Sure.
Okay, sir. So before we continue, we'd like to do a brief introduction of our speaker. Dr. Theophilus Okonobu is an exceptional individual with a diverse range of talents and a strong drive for achieving success. Currently practicing as a medical practitioner at Nnamdi Akweze University Teaching Hospital. Dr. Okonobu is deeply committed to the health tech field and actively engaged in research. He is also dedicated to empowering the next generation to embrace the intersection of technology and healthcare. Through his effort, he seeks to unlock the potential of young individuals, inspiring them to make a positive impact in their communities. He is also curious extent beyond the realm of technology and medicine. He is a seasoned leader and a fit traveler and a lifelong learner with exceptional skill, unwavering determination, and a genuine desire to make a positive impact. He strives to create a future where advancement in technology benefit individuals and society as a whole. Welcome, sir.
Thank you very much.
You're welcome, sir. So before we continue, we would like to make a research on this study, in this case study, about a young woman who decided to undergo an implant for a child sparing, but her husband did not understand the situation after a 5-year implant. She experienced irregular menstruation and difficulty with breastfeeding. After a month, the implant was not feasible, and she has to visit multiple hospitals to remove it. She was reversed to a gynecologist who prescribed a medication for irregular menstruation, but the implant was hidden under her. So please, I would like everyone to drop your comment. How far is this young woman with this kind of pain that she's been going through? Follow us on YouTube. Drop your comment, drop your advice, how this woman will be able to remove this implant that has already affected her a lot. She has been going through a lot. So drop your comment, drop your advice. Follow us also on Facebook. Drop your comment. Thank you, everyone. So Faith, over to you now. Hello, okay, Faith is not on. Sitina, over to you.
Hello. Thank you so much, Esther, for that beautiful intro and a case study. And I would like to say, Dr. Theophilus Okbonakan, indeed, you are an exceptional person of your time. Yeah. And it is good to learn that you studied from Nnamdi Azikiwe University. Well done, sir. I know it's not easy making it there.
Thank you very much, everyone.
Yeah, thank you. Okay, so on just the case study that just been taken, that is the story of a woman who undergo an implant for child spacing, and then later on had a lot of issues and difficulties. And in this case, it turned out to, we came to realize that this implant was hidden under her flesh because her body became enlarged, and then even the doctors themselves could not get this removed. So at that stage, she was given, she was asked to, she was referred to another person who was a gynecologist, and then later he was able to prescribe some of the medications to help her overcome this pain, and then to help sustain her to the expiration of this implant in her. So, and then ever since then, there had been a little change. But I want you, doctor, to throw a bit of advice to some of our women out there who might have been going through same cases. So over to you, sir.
All right. Thank you very much, everyone. Good evening from this part of the world, wherever you're listening to. Good morning, good afternoon, good evening. Well, this is a very interesting case study, I must say. Though there are a lot of things that medically we need to ask questions about, and the idea of she meeting or being referred to a gynecologist, an obstetrician gynecologist, is really, really good. Though an obstetrician could have been very much helpful in this case. Uh, well, for this lady in question, first of all,
Mm,
with the implant, the thing is
mm,
that we expect implant to the expiration date for implant to take about 3 years, depending on the types, for 5 years. Okay. And afterwards, it is expected from studies have shown rather that literally uh, implants being the most effective or one of the most effective way of preventing
mm.
pregnancy,
Yeah.
implants can actually be reversible, and fertility is not
Okay.
a problem after taking out the implant, okay, which can be removed anytime.
Mm,
So the thing now is I can see that from the case study that she experienced irregular menstruation and difficulty with breastfeeding. Does that
mm.
mean that she has, after the implant was inserted, she gave birth and she's having difficulty in breastfeeding? Just want to know.
Hmm. Would say she that was during her breastfeeding period, and then she felt it was important to keep herself um safe from getting another pregnancy. And since the child is still breastfeeding and still tender, and then to also give that spacing for before another pregnancy comes in
Okay.
for another childbearing. And at the process,
Okay.
the body of a woman enlarges in most cases, especially when she's well taken care of. And then
Yeah.
this came to happen that as a body enlarges, this implant that was inserted in her got hidden. So while she was talking to us, when we had an outreach, we're communicating with the women, and she shared her story with us.
Okay.
And then we advised that it is always important that you meet the right persons for this. And then we also asked, were you
Yeah.
diagnosed? Were you diagnosed before on uptaking this? And the answer was no.
Exactly.
Yeah, the answer was no. And there, I think this was one of the where the issues were coming in from. And so we believe some of them will be joining so they can also learn from this. That is why we need to hear from you as an expert in the field.
All right. The thing here is that progesterone, which is one of the like progesterone is actually a natural hormone produced by the body. It's a steroidal hormone produced in the body. Well,
Yeah.
implants actually the kind of is hormonal in function,
Mm.
and it produces the hormone we call progestogen, which has a similar type or chemistry with what's called the progesterone. Okay, so
Yes,
now if we then use progesterone, it literally does not have negative effect against you against breastfeeding. Okay, so
okay.
and side effect actually, because in medicine we never say never. Okay, out of
Mm.
100 you can have that one that which she maybe does that one. Okay, so
Mm.
one of the side effects you can find using implants are things like sore breast or tender breast. Okay, which if
Mm.
a lady or a woman, a lactating mother, is having a tender breast, it's definitely during breastfeeding she may
Mm.
feel that discomfort with it. And also it could be what type of implant that was used and who she met, just as you said earlier on. Was it
Mm.
a professional who did this? Was it a specialist who had this inserted? Okay. So from study, as I said, irregular menstruation is normal. Actually, some may have no menstruation at all, which you call amenorrhea. Some may be little, some may be, very copious, so much, like which we call menorrhagia. You get so whichever way you can see all about the symptoms present for a lady like this. But with what I can see here, it is expected that at least 3 years at least it should be done with that implant should be expired. Though sometimes take about 5 years. Things like that Jadels like 5 years, but Implanon is a type of implant, 3 years. Okay, so as regards the part that the implant was eating in our flesh, well, one of the things that we expect for a lady with an implant, because the implant, we place it around the inner part of the upper arm, you see that she could still be feeling it. As I said, depending on the cadre or the level of special of experience, how would I put it, the level of expertise, whoever might have done that procedure for her. Okay, so it is expected to find this. It's not abnormal. However, what we can do as specialists in the field or as medical practitioners in the field is to help tackle these symptoms. We could have the implant for us. We could even use if it's an X-ray, a CT scan to also try to search for the implant where it is expected to be, because it's not inserted into the bloodstream that we're expecting it to float around. Okay, okay. So we expect, okay, fine. If we're having difficulty in looking for this, we have um, equipment, radiological equipment that could be helpful to trace this device, this contraceptive device in this our context right now is implants. So that's what I have to say about this. Thank you.
Wow, that's beautiful, sir. Thank you so much for sharing such more light on that. And I believe our women out there will take up corrections from this and then be able to keep themselves secured from getting themselves involved, going for an implant without being diagnosed or taking through the right processes. Because in most cases, from what you've just shared, this happens because it is not a professional that has done this. So
Well,
yeah, so
I have something to say. When you say being diagnosed, I don't get what are you pointing at?
As of taking an contraceptive rather.
Okay.
I believe every woman who wants to undergo such should undergo what is called diagnosis to be tested and known what type would be suitable for them before going for it.
Okay.
Yeah, which in turns,
Well,
in most cases, once that is not done, has a huge effect on them. Yes, and that is why there are kind of misconceptions, a lot of misconceptions about somebody going for family planning and all and all and all. So I believe I am not I'm not an expert in the
okay.
field, but you are, so you should know better.
When I hear the word diagnosis, I was like, okay, it's like she is passing through something pathological, like she's having a problem. But family planning is in most cases, a choice.
Yeah,
And I
exactly.
think, yeah, that when we come to bed space and family planning, what the woman would do, or when she sees a doctor, definitely a doctor will ask some questions, which you call taking some history, asking some important questions like, okay, do you have breast cancer? Do you smoke? Do you have any severe liver disease? Based on all those things, we can be able to say, okay, we would use this for you. We'll rather use this other means of contraception or this other contraceptive device instead of this. Instead of it going with an implant, you can go in maybe with something else, maybe the natural methods, maybe vaginal pessaries or rings, so we can be able to prescribe correctly I don't know if that's what you mean by the diagnosis here, because when I hear diagnosis, I'm
Exactly,
thinking of something else.
exactly.
Okay.
Yeah,
Okay.
exactly.
All right.
Yeah. All right. Thank you so much, sir. So I would say, so do you mean it was wrong for a breastfeeding mother to have gone for that? Was it wrong? Had she
Not
taken
at
the
all.
wrong decision by going for that?
Not at all. Not at all. As I said,
Wow.
implants are only impregnated with progesterone only.
Mm,
Okay. And it's not going to stop her from giving breast milk. Actually, we want to give such within the first 6 months, because we're expecting our lactating mothers to breastfeed for strictly breast milk for the first 6 months. Okay, so it doesn't disturb that. No, there's no disturbance. However, as I said, in medicine, we never say never. There's always that, okay, there could be that 1%, that 0.01% that may bring about that exception, okay? But from the cycle, when it doesn't affect that, it doesn't affect that. Its job is simply, don't let me produce more eggs. Don't let any other, which we call the sperm, come in to fertilize paraventure and egg is being ovulated, okay? So that's the major target. And also, implant actually bring about slow release. Even when we
really?
use it, even when it's for a long time, but it's not like you just take it and you're expecting immediate action. Funny enough, it can
Really?
even take like 7 days. Yeah, yeah.
Wow.
So it's slow release of the hormone, which will now send a kind of feedback to the brain. Like progesterone, we also can call it like a pregnancy hormone. So it does have that feeling like, oh, this person is probably pregnant. But in reality, in the real sense, there's no pregnancy. So it brings about that spacing for that duration of time. Yeah, I think I'm trying to explain it to like bringing this explanation down to the barriers I think I can break it down to. So it's actually slowly, just like as I say, little drops. And then the body system has a way of, removing um excesses. All right. So that's why the case study, as I said, it's a whole lot. Again, there are a lot of um, reviews, or a whole lot of, like how would I put it, some questionings, or deep interest into this case. I love this case study a lot, because it's like out of the norm. When everything is yes, 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 you get that no, I like, okay, why? So however, when we see side effect like this, one of the things is we stop. We try our best, we remove the implant, which we are thinking is the major source. And secondly, we can then check, could there be other things affecting or causing these things to happen? All right. Is there a problem with our glands that secrete the prolactin that is affecting breastfeeding? Should there be, we just have to do, investigate deeply to get the root cause. But of course, we have to remove this implant and be sure that it's no longer coming from this. And beyond 5 years, we're not even expecting it to give us appropriate function, or expecting it to function. It has expired.
Wow.
All right.
That's
Thank you.
beautiful. Thank you so much, sir, for throwing more light on that case study. And we're supposed to do a quick recap of what we had discussed last week on the section. I don't know if you might have one or two words to chip in before we move to the next section.
Okay, is it this? What is an implant? Okay,
No,
cross-generational
cross-generational sex, yes.
Oh God, why me on this? Well, I think
Okay. But if you don't
cross-generational
want,
sex, talking about extreme ages, Abby, right?
yes,
Extreme ages.
exactly.
Well, I feel, to me, I'm one person who let people have the choice.
Really?
In as much as I would be happy to see a 70-year-old to a 12-year-old. But you see, if there's an agreement, consensual agreement, I understand, man, it's your life. Sorry,
Wow.
sorry to sound that way, but
Really? Really?
you want my
Wow.
opinion, all right? But
Yeah.
no,
Go ahead.
I don't want to judge. I don't want to
No.
sound judgmental. But the
Yeah,
thing there
of
is that there are
course.
a lot of side effects that are really a lot of side effects. Also, the stigma you get.
Exactly.
So that's good. If we are bringing in all these parts, yes, we can say, okay, fine, because of this, not like if I ask you a question, is what did they call this thing again? I don't know how it just left my head now. Is circumcision bad for males? Let's leave the female part because it's a whole lot to them. Is circumcision bad for males? Sorry, I know this is a female session, but do you think it's bad? Now you're thinking, should I say yes, should I say no? So this is the same way this your question is coming like. So
Okay.
so when I get to look at extreme of ages, I can be like, okay, fine. There are risks of things like vaginal vesicle fistula. Okay. Please, this lady is not fully mature, or this young man is not fully mature. The mental health of these individuals, so it's really the stigma, the now we have a lot of disease spread, the level of immune system these individuals have on their various extremes of age. So I feel, in my own opinion, it's
All right,
choice.
all right, thank you. You've just said it is choice, and then everybody should have rights to what they want, right? That is what we are saying. Okay, fine and good. All right, so we will moving straight to our discussion for today, which is implants as a modern contraceptive method.
Okay.
And then I will be hanging up here to my co-anchor, Elizabeth. Are you there? Elizabeth, are you there? Okay, fine. I guess you'll be connecting shortly. So we'll be taking a question on the screen now on this phase. We're talking about deep into now the implant. What is an implant and how does it work in reproductive health of young women and adolescent girls?
Interested. Okay, first of all, I wish I can have an idea of my audience, the kind of audience I'm having, so I know to what degree the level of information I'm to share. All right.
Okay, fine and good. Where our core targets here are women and are young adolescent girls. So from age 12 upward should be able to have access to this right information that are non-judgmental, and of course this will guide them through their life path as they grow.
Exactly. Okay, so for that I have to, because let me know if I should start, because implant is like a big word. Hey, implant. Okay, so first of all, I need us to understand that the idea of this is contraception. And when we talk about contraception, we're talking about preventing pregnancies. So whatever device you use to prevent pregnancy is called contraceptive, okay? And these devices, these contraceptives, they can be classified broadly into things like hormonal contraceptives, which is where implant falls under, because as I said earlier, implants is secret hormones. So we have hormonal contraceptives. So the idea with the hormonal contraceptive is, okay, fine, I give you, how will I put it now? Let me see. It's just like using a corn to, lure a chicken towards your side. But now at this time, you're telling the chicken with the corn, I don't plan to hurt you when you plan to hurt the chicken. Okay, so the idea of hormone is that, yeah, naturally the body produces hormone, but it's regulated. Okay, there's a balance, and when you aim to alter this balance to make one hormone more than the other, you're causing, a reaction to happen. So, but this reaction is actually an intended reaction. You want it. You actually want this thing to happen. Okay. So
Yes,
the
sir.
body has some hormones, like we call the estrogen, the progesterone, which are two major hormones involved in pregnancy settings. So when I increase one and I decrease one, I am intending to let something happen. So when I want to talk about how it works, I think I will explain further. All right. So we have the
Yes,
hormonal
sir.
contraceptives, we have the intrauterine devices. So
Okay.
that I know some of you also might have heard about copper, use of copper. At least that one could stay like 10
Yeah.
years. Not like the problem is that you could actually perforate the uterus during implantation, you know. So you have the progestin releasing IUDs, that's intrauterine devices. We have the barrier methods. A lot of us know that a lot. Use of condoms, diaphragms, you know. So, and then the condom barrier method is actually one method that is so far the only we have that I still, yeah, let me just for now, because we are improving with science, that helps to prevent STI. If you use implants, you can still contract STIs. If you use your IUDs, you can still contract. So barrier methods you get. So which also prevents, it does the 2-in-1, prevent pregnancy, contraceptive that way, and as well, to some degrees, prevent STI, because there are some things that it may not be able to prevent, though this is not the area of our topic today. So you have things like permanent method. Some of us know tubectomy, tubal ligation, tubectomy and vasectomy, natural methods, you know, using, or maybe my safe period, let me work with that. You get some use emergency method, which a couple of people use, all right, when they feel
Yes,
they've gone so wrong. So when we look at hormonal contraceptives, we have the combined oral contraceptive pills, the ones that has both estrogen and progesterone together combined. We have the ones that are combined injectables, the vaginal rings, combined vaginal rings. We have patch. You just patch it on the skin, and then it starts giving out, secreting these hormones. We have the progesterone only pills, and then we have this implant. Okay, so implant majorly is just, we just have progesterone it produces, and it is used especially for people that have negative reactions to estrogen. So people with negative reaction to estrogen, maybe like some of them, because estrogenic effect to you see some persons when they take some contraceptive like this, that I made mention of, this combined oral contraceptive pills. When they take it, you start seeing that maybe they start having weight gain because of the estrogen content, acne, that's pimples you get. So having irregular menstruation. So these things are curtailed when we use implants. Okay, so you cannot say contraceptive implants is just a type of birth control device, and they are inserted. As you can see this image, those are the inner part of the upper arm. Okay, of the arm there, you can see those are the inner parts. That's where they are implanted or inserted or fixed into the woman's skin. Okay, and it is, as I said earlier, it is one of the most effective. It is reversible. It is long acting, and you can take it out. You can take it off whenever you like. Okay, you don't need to wait for 3 years. You can take it off whenever you like. It's just like a matching stick, as you can see there. Some about 4 centimeters in length. It is easy to remove. It is helpful in people that, as I said, that have problem with estrogen. It is helpful with them. So how does it work? As I said, it's release an hormone, which we call progestogen. And this hormone, I think there was an image I have on my phone that would have helped us to explain this thing. I don't know, I sent it over, but I had it in mind to use it to describe. But let me just see if the image is not here. I could just try to explain. In the body, we have a set of hormone we call, I don't know if you are familiar with the word ovarian cycle, menstrual cycle. I don't know, are we? And
Hello,
Yes, we
sir.
are.
Yes, we are.
Okay, so now there is ovarian cycle has two major hormones that helps in its regulation that we call gonadotropins. I'll break it down. Gonadotropin can be divided into two: the follicle stimulating hormone and luteinizing hormone. And when we look at this follicle stimulating hormone, it helps in the maturation of the egg. We call the egg oocyte. I'll use the word egg for basis of this discussion. So for the female egg, this follicle stimulating hormone, it helps it to mature. And as the egg is getting mature, which is a part of the ovarian cycle, because when you look at the maturation of eggs, it concerns that ovarian cycle, which occurs simultaneously with the menstrual cycle that has to do with the which you call blood leaving living through the vagina of the woman. So that one is that the menstrual cycle, which is when we talk about cycle, some people pronounce that cycle rather. Okay, when we look at that, we can then say, okay, this is menstrual cycle, and we have the ovarian cycle. Okay, so when this hormone, follicle stimulating hormone, comes in to mature this egg itself now stimulates the ovaries, because the ovaries produces this egg, stimulates them to produce what we call estrogen. Estrogen's effect also helps to signal the brain to produce more of that luteinizing hormone. I don't know, these things are that why I asked for the audience. So I've said the major way it works is the production of or release of progestogens, or that is, you can still say like progesterone. Okay, so when this estrogen is produced, it helps to trigger luteinizing hormone as well to be produced. Luteinizing hormone is, when it increases, it is responsible for what you call ovulation in a woman. Now, this egg, after ovulation, the eggs come out from, I don't know the sample I can use. If you have a fruit inside, like mango has one seed inside with something covering it, right? So now when whatever is inside the egg comes out, which is what they call ovulation, when it's out, it has matured. The mango has matured. This mango, I'm using it just analogous to egg here now. It has matured, it has ripe, it is now ripe. Because of luteinizing hormone, it's then open. And this luteinizing hormone, actually, the estrogen helps it. It triggers the production of the luteinizing hormone as well. But the luteinizing hormone, as I said, is also a part of gonadotropin. Sorry, this may be sounding too medical in terms, but please bear with me. I've already mentioned the full idea of that is progesterone doing this job. So after that ovulation, with the sheets remaining, the coverings around the egg that was developing inside begins to form something else we call corpus luteum. And this corpus luteum is responsible for producing progesterone before the placenta takes over. Now, when there is no fertilization, the corpus luteum begins to shrink. And as a result, it becomes atretic, it dies off, okay? So progesterone that it's producing stops. That way, the cycle now comes back again from the beginning. Now, when the progesterone stops, estrogen comes in, you have shedding off of the tissues, that's of the uterine tissues, of the uterine wall, so which we are now calling menses or menstruation. So the idea of this hormone is that as it is releasing this progesterone, whether corpus luteum decides to shrink or not, the body is saying that there is more progesterone in the body. I don't know if you get the idea of this. And in that way, or in that light, the brain will not start saying that, okay, to the brain, you may feel that there is already implantation, that fertilization has taken place, more progesterone is now being secreted, because, as I said earlier, if there is no fertilization, that corpus luteum will shrink, therefore no more progesterone produced by it. But if there's fertilization, which means the sperm and the egg, get united, corpus luteum will continue producing the progesterone. pending till when we have placenta taking up the function of the production of progesterone. All right. So with this implant that is producing progesterone, you can now see that it can send negative feedback to the brain saying that, okay, do not produce more LH, which is luteinizing hormone. That way, you are no longer expecting to have ovulation again. Because as I said, luteinizing hormone is helpful in what? Ovulation, which is that production of egg. Okay, so this is the way that this implant works. Implant it's not impregnated with estrogen. It is majorly progesterone based. So this is the way it works. I hope I've not missed so much. Thank you.
No, no, no. No, no, you've done enough justice to the question in hand. Thank you so very much, sir.
You're welcome.
Can you hear me?
Yes, I can, sure.
Okay. Okay, we have discussed, you've mentioned um
All right.
how long the implants should last in a woman's body. I think you said something like
Okay.
3 years to 5 years, right? If I'm
Depending on the
correct.
type, but majorly 3 years
Okay,
that we have around next planon,
okay,
implanons, we have major 3 years.
okay, okay.
All
All
right.
right, we'll be moving on to the next question, which is
Oh,
how
okay.
is the implant inserted and from what age, like what age bracket of a woman or adolescent girl should be able to use the implant or can use the
Well,
implant rather?
interesting. What age bracket? Well, I don't expect a 4 year
Mm,
old to get pregnant. I don't expect that. So I would say from
of course.
yes, I would say from the pubertal age, depending on when
Mm,
puberty sets in for the woman. Some I've heard of as early as 10 in some ladies, some 9, while some even coming as late as 16, 18. So things we've seen some cases like that over here. So as
Hello,
that,
sir.
yes, I'm with you.
Yeah, yes, you know why we're asking this question because a lot of young ladies, nowadays they are being advised to use like contraceptions like pills and maybe
Yeah,
female condoms. Not
yeah.
they don't usually advise them to use implants. That's why we have to ask because to me I actually thought implants are reserved for
Hello,
the more elderly women.
I can hear you now.
Can you hear me, sir? Yes, I said we are asking about the age bracket because in schools nowadays or sexual experts usually advise
Hello, hello. I can see you could some moving though, but I can't hear you. Hello. Let me
Like
be sure.
network is
Okay.
bad.
Okay, that means not
Continue,
from my end.
doctor. Yeah.
Okay, so as I said, from what age group? Well, first off, I would like to say I listed different type of contraceptive devices. Okay. The thing is, different contraceptive methods may suit any individual at any different time in their life. Okay, so the sexual experts are not wrong to say use of condom, at least it is affordable. If you cannot abstain, at least be faithful, condom use, that the rule of ABC that they've been ringing. Okay, so you can't abstain, at least be faithful. If you can't be faithful, then use a condom. So um as long as, for me, I would say that as long as the lady is within pubertal age, capable of getting pregnant, yes, she can have an implant. Okay, but why a lot of persons don't really, as I said, it depends on individual basis. They just feel one, to some people may find it expensive. Then well, it's kind of weird. let me see a 12-year-old girl going around, maybe, maybe with a well, it's still in the inner arm. Well, so from pubertal age to menopausal age, I don't expect a 65-year-old woman to be on an implant. What are you trying to, what form of contraception is that? From menopause, you're not expecting, we least expect, them not say not expecting, we least expect pregnancy to occur. So just within that age range is fine. All right, just within that age range is fine. So, well, how it is inserted, well, it may be inserted, as I said, into the skin of your inner arm, upper arm, depending on whatever upper arm. Anatomically we choose to call it the arm. All right. So that's how that image is showing. Yeah. So we place it there. Don't worry about the pain. You may feel some discomfort, yes, but we use what we call local anesthetic that will help to numb the area, to make you feel no pain. It get inserted there. That's all. But please meet a specialist if you must carry out this procedure. Please. So that's just it for that question. Okay, is this the next?
All right, thank you so much, sir. No, actually, I think you've answered it during our conversation, but
Okay.
Elizabeth got disconnected and she will be joining us again. Maybe that is if we've not rounded up. Okay, so our last question is the next question we'll be taking is
interesting.
Can you move to the, okay, I think the slide is here now. All right. Are there any potential side effects associated with implants on young women and reproductive health? And if there is any, what can be done to that effect? Okay, so we'll be this is our last question, so we'll be rounding up here, and then we're expecting more questions from other people, from other women. If you're opportune to join us next week, then we can continue from there to take up other questions from the women. Thank you.
Okay.
All right,
are there any potential side effects? One thing I always tell my mom then is, even now I tell her, all drugs are poison. What
really?
matter is the dose. What is affecting us is the dose. Yeah,
but we
are
told
the problem.
It's good for our health. Medication is good for you.
So when you're not sick, you happily take them, right?
Exactly.
So that's even when you take water too much, like you're gulping it, you could hurt yourself. And when you don't take at all, you're hurting yourself. Okay, so well, implant is no exception. All right. So someone could experience a change in menstrual pattern, just like the woman in the case study.
Okay.
It's expected. It could be more, it could be less, it could be not at all. You get. So now, this is not a problem at all. Depending on which, we can then help. We can then help to give medications that can help reduce the effect when it comes to like disorders in menstrual flow. Well, headache can also be another thing the woman may experience. Of course, we could help with medications for that. Because progesterone has a way of reducing what you call peristalsis, movement of the bowel, movement of the way the intestine meant to go like up, down, whatever thing you eat goes down. So it's kind of, I don't know what example I can use now to describe what I'm saying, peristalsis. So peristaltic movement is just, have you seen a snake swallow something? You see the way it will be moving slowly inward.
Exactly. Yes, we have.
So peristalsis is more like a contraction, relaxation effect that helps to push whatever content inside the bowel up, down. Okay, so one way or the other, progesterone has been found to kind of reduce peristalsis, thereby causing constipation. So you may now see that the woman's abdomen, she may start bloating. Okay, so of course, there are drugs that can help to, laxatives and all that can help to relieve that symptom. Well, she may have changes in her mood. Again, she could have changes in her mood. Obviously, that could be taken care of. Could we give antidepressants? You could give antipsychotics. Yeah, depending on what the presentation is. There could be changes to the skin where it is being implanted. There could be discoloration of the skin. The skin could be swollen. There could be a scar. So this could be side effect. Another very important side effect is STI. Because you have an implant, does not mean that the person is free from HIV, from hepatitis. No. So people not say because it's contraceptive device, it's also contraceptive to, it's also against herpes, HIV, and the rest. No, please. Condom can't. That's why they say 99%, because there are some STIs that can still be contracted, especially the genital warts and the rest. So
really?
Yeah.
Even with the use of condom?
Yeah, because the scrotum would actually touch the fluids coming out from the vagina, or the other way around, if the man has. So is the condom covering that part?
It is not. That's true.
So that's why they say it's not protecting 100%. All right. So
yeah.
Then, as I mentioned, scar formation. I've mentioned earlier, the breast could be sore, it could be painful. Okay, and that's also we don't use implants for someone with breast cancer. We don't. Okay, so it may, as I said, it may not be good for people with, I said it earlier, with breast cancer, with liver diseases, people that are on certain medications. Well, I don't know. Are we done? I think
yes.
Okay. So don't worry. Once you remove your implants, fertility will return back to normal. That's what it is. Studies. Yeah.
Wow, that's great. Thank you so much for this beautiful knowledge you've taught us today, because this is indeed your knowledge, because I've learned a lot from this discussion today, and I believe our women out there are listening, and then they are yielding to this, to keep this as an advice, to keep them going. And of course, women out there and young girls, please, you've heard what our daughter has just said. Yes, please, and please, this is believe by choice, not by chance. Remember, every day. That is our message, or our preaching for you. We say, carry belle by choice, not by chance. Yes. Okay, so as we round up here, we'll be saying a very big thank you to you, sir, for honoring our call, Dr. Theophilus Okonobo. Yeah, that's great. Okay, I think the name is so beautiful that we are all, yes, we are all struggling to call the name like. All right, so thank you so much for coming on the call, and we would sincerely say we've learned a lot from what you say. If you have the opportunity to join us again on the next episode next week, we will really appreciate that, because there's still a lot more to hear from you. Yes. Exactly.
Okay, that's how next week goes. If I can be able to sniff out some time, fine.
All right.
I'm really happy with what you all do with age. It's really impressive, and I appreciate it.
Wow, thank you so much for that. Yeah, thank you so much. So this Bella by Choice Facebook live chat was streamed live on YouTube, and then it will also be shared on our Facebook platform. So should you have any girl around that or a woman that you know would need some of this information, you could always refer, and also would like you to also share with others. Let them hear you while they were talking to us on the discussion, as well as like to other networks. You can also refer some of your colleagues that would love to also make impact in the lives of those women as well, just as you've just done today. Okay, so are you a woman with an unmet sexual and reproductive health rights and needs? You can speak with our sexual and reproductive health experts on our lines on the screen at 070-480-65486 or 070-480-65450. Also, if you're based in Calabar, we also have some of the sexual and reproductive health offices present there in Calabar Municipal. We have in Biase, Boki, Akpabuyo, and quite a lot number of them. So we'll be expecting you all to, you can just reach out to these people, these contacts on the screen, and then you get all information that will help you build up your meet the needs you want. Yes, your sexual reproductive health needs, because that is our priority as women. And then don't forget, we'd like to see you all same time next week on the same call as we continue on this same discussion. And I believe we'll be having two powerful people in the house. Yes. So our doctor will also be available to share more light on this, as well as another person in another health expert will be joining the call also. So we'll be honored to have them. And then I will believe you will come with much expectations. As we round up, we say a very big thank you once again to our amazing partners for their support. Thank you so much for your endless support for Age Network Belle by Choice. We are really grateful. Thank you everyone for joining the call, and do have a lovely week ahead. And thank you, Doctor. Thank you so much. I think I see we've taken much of your time already. So thank you so much for coming on the call once again. And do have a lovely day. Bye. Bye. Bye, everyone.